Yeah, ma'am, I'm ready.
All right. So if you've read and understood considering its surgical pathology station, please tell me what you understand by the term diverticulitis with endometriosis in the lab report written.
Diverticulitis is the inflammation of the diverticula, and endometriosis is implantation of the ectopic implantation of the endometrial tissue in other parts or
Okay.
other tissue.
Yes, right. In this case, there has been histopathology or the biopsy has been taken, but in a normal condition, how one should manage a patient like this?
Uh, there is conservative management and surgical management. Conservative management is we need to make the patient NPO, give fluid,
By
give
mouth, yes.
antibiotics, and if we can percutaneously drain the uh, purulent or abscess matter after after the diverticula has been inflamed or infected,
Yes.
or we can do a surgical procedure like diversion colostomy or Hartmann procedure, or we can do colocolic anastomosis as well.
Okay. What treatment can one offer to the patient?
In this patient,
Yes, please.
the patient had perforated colon. We can do Hartmann procedure, or
That
we can
has
also
already been done.
surgeon
Yes. What more? Okay. Please define or tell me the pathogenesis of diverticulosis.
Diverticulosis is due to the unique structure of the muscularis propria and increase intra-abdominal pressure in the colon, in the sigmoid colon, the nerves, the arterial vasa recta, and the sheet penetrates to the inner circular layer of muscularis and leaving the focal uh,
Your voice has disappeared. I can't hear you. Please tell me the complications of
uh,
diverticulitis.
complications are infection, diverticulitis, pericolic abscesses, perforation, or fistulas, or intestinal obstruction.
How would you classify perforated diverticulitis?
We use Hinche classification for that. It has one grade is pericolic abscess formation, 2A is distant abscess, which is amenable to percutaneous drainage, and 2B is complex abscess associated with fistula, not amenable to percutaneous drainage, and 3 is purulent peritonitis, and 4 is fecal peritonitis.
Please help me and understand how did the endometriosis or the yes and uterine endothelium has reached the colon?
There are four theories. One
Yes.
is regurgitation theory, in which the endometrial tissue is regurgitated or refluxed during
Yes.
the endometrial shedding into the peritoneal cavity. And the second is benign metastatic theory, in which the endometrial tissue is spread to the other parts like bone, brain,
Yes.
through the blood and lymph. Another is metaplastic theory, in which says that the endometrial tissue develops from the coelomic epithelium or epithelium of the abdomen and pelvis, and metanephric met, met, metanephric remnants also differentiate into endometrial tissue. And fourth theory says that progenitor stem cells also differentiate into endometrial tissue.
All right. Okay. Please describe the epithelium of the uterus.
It is simple columnar epithelium supported by the vascular stroma, and its inner lining is the endometrium, which consists of basal and functional layer, and functional layer is hypertrophied and sloughed during the menstruation.
Okay, what gives or makes you worrisome knowing that patient could have endometriosis?
Because it can lead to ovarian cancer, which has 3.5-fold increased risk.
And not lead to, but can increase the risk of. Okay, right. Why endometriosis causes pain?
Because of the intrapelvic bleeding and uterine adhesions and release of the substance P.
All right. Uh, the same patient, after she has been operated, underwent Hartmann's procedure, etc., and you have seen the lab report, after a few days, she visits you and complains of left iliac fossa pain. What would be your provisional diagnosis? What would you consider?
Most probable would be pelvic abscess.
Yes, how would you rule that out?
I can do an ultrasound
Yes,
for any collection,
yes.
and if there is any collection, I could treat her with antibiotics and analgesics.
Okay, does pelvic abscess always results with fever? Can there be a fever all the time?
No, hot abscesses cause fever, but if there's a cold abscess, it doesn't cause fever.
Okay, if you'll help me and read this images. There are in fact two images in front of you. Can you help me and read those?
No, ma'am, sorry.
You'll be able to point out or recognize intraperitoneal picture. What are these cysts, or what are these? Because if you'll
Yeah,
see a patient with diverticulitis and endometriosis, they'll have a brown powder like dark blue, black chocolate
yes,
cyst.
chocolate,
So
chocolate cyst.
this is present in the gastric epithelium or in the stomach, and this is the uterus, the uterine, and these are the dark ones. Okay,
Okay, ma'am.
right.
Okay.
And if you could tell me the layers of the uterine epithelium or the uterus.
Yes, ma'am. As I said, the inner layer is endometrial, and there are two other layers, basal and functional. Functional gets sloughed during the menstruation, and the basal layer is the outer layer.
In case of infection, there is increase in neutrophils. Can you help me understand how neutrophils migrate to the site of infection?
Yes, first there is margination and rolling to the endothelium, and second is adhesion through the integrins, and the third is transmigration with the help of PCAM1, and fourth is migration to the chemoattractant stimulus.
Stimuli. Very good. Thank you.
Thank you, ma'am.